Hi, I'm Matt Willis with the COVID-19 response update for Marin County for April 16th. I've been sharing data from our public COVID-19 dashboard for the past couple days, but today we're going to focus on a more urgent topic. One of the most important decisions that public health officers will be considering in the next 2 weeks is any potential changes to the current shelter-in-place order, which ends May 3rd. Options include extending with no change, lifting the order completely, or extending the order, but with limited modifications to allow some loosening of restrictions. The regional public health officers who authored the first shelter-in-place order have decided to go with that third option, a careful and sequential alteration of the shelter-in-place order. This process will include looking at each element and assessing the risk of transmission of virus in that setting and the ability to conduct business in ways that are safe, including physical distancing. So the question is, how can we safely begin to consider allowing more social interactions and more travel within our community, knowing that this virus is still part of our environment? One important measure that we can all take is to cover our faces when we're in situations where there could be transmission of the virus. With that in mind, Marin County and other counties in the Bay Area will be moving forward with an order requiring facial covering in certain settings. The order will be issued tomorrow and will go into effect at noon on next Wednesday, April 22nd, to allow time to prepare. This order amplifies the existing recommendation to cover our face. The specific language will be posted tomorrow, but in essence, this order will require facial covering for public settings where we are coming into contact with people within 6 feet who we don't live with, particularly indoors. Children under the age of 6 are exempt. We don't need to wear it when we're alone indoors, with those we live with, or out by ourselves on a walk. If this just feels like another order, it's important to realize that this actually enables us to lift other, more restrictive orders. One of the reasons this is so important is that we're learning more and more about the risk of transmission of this virus from people who are not having symptoms. People who become sick can become contagious for up to 2 days prior to the development of symptoms. And some remain asymptomatic, although they are infectious. For this reason, we can't rely on symptoms alone as a sign of whether someone is contagious. The good news is that a simple facial covering with cloth will effectively reduce spreading droplets into the environment, which is the main way COVID-19 virus is spread. This order does not require masks such as surgical or N95 masks and will not impact the supply of personal protective equipment so important for our healthcare workers. There are many simple ways to cover our face that are effective, including the use of a bandana or making a homemade covering. The CDC has handy instructions which we will post on our website, shown here. And here you see examples of all of the different types of masks that can be used effectively to cover our face. Covering our faces is something that we do to protect all of us. The decision to cover your face is a decision to support our well-being as a community. And if we can really do this, if we can get this down, it will help eventually give us more freedom to travel and interact more within our community. Facial covering will be an important part of the new normal. Your work as a community in sheltering in place has flattened the curve over the past month and has shown how powerful we can be when we act together. In order to be successful in this next chapter, we'll need to keep that same spirit as we make new choices in how we relate more safely when we're together. So, thank you, Marin. Cover your face and stay healthy.